Dr. Cummings, you've treated some men with homosexual issues. Have you experienced helping certain patients overcome their homosexuality, or at least diminishing their same-sex attraction to some extent?
Yes, I have. It's a difficult therapy, and it's not huge in terms of numbers. But yes, have seen success, and this is why the stance that you can never change. Ronald Reagan said, "Never say never." It's absurd. All you have to do is find one exception, and it knocks down the never. Exactly. But yes, I've experienced more than one exception.
Now, as the therapist, what did you do to facilitate the man to overcome his homosexuality? How did you try to help him?
I would try to, first of all, I would latch on to their determination. If they didn't have that determination, it was usually because of their background, their religion, whatever. And the gay movement says that's a bias. You should tell them to abandon their religion because their religion is telling them a falsehood. That's not respecting where the patient is. I would start where the patient is, and then I would go back into the various aspects that impinged upon their becoming gay.
Childhood experiences? Childhood
experiences. For example, I found that masculine-appearing men who were seduced by an older person in their boyhood were more likely to succeed than boys who, at 4 and 5 years old, were wearing dresses.
The pre-Oedipal type or the post-Oedipal?
Absolutely, yes.
So that's a distinction?
Absolutely.
So the prognosis is better with the post-Oedipal?
Yes, it is. And yeah, there were these facts, but the point is that everybody who wanted to change didn't. I mean, we had failures.
Yeah.
Admittedly, we had failures. The recidivism along the way with some would be in tens. But we experience the same thing in treating substance abuse and alcoholism. Falling off the wagon is part of the treatment. So we would persist as long as the patient wanted to proceed. And yeah, there are successes. The latest thing about whether or not reparative therapy works, the committee that considered this would not allow anyone on the committee, as we well know, that does reparative therapy. And this kind of bias prevails in the APA, all under the scientific aura. I think the APA has become a monolith. I don't think any one individual can change. The APA has become politically correct. Political correctness rules, not science. Sorry to say.